across the country continue to struggle with a shortage in hormone replacement therapy products. First, it was the estrogen patch, and now some women are finding that their progesterone is also out of stock.
Consumer investigator Christine Lazar looks into what's being done to help and why the FDA has not declared this a shortage yet. Christine, I know so many people who can't get their hands on this stuff.
Yeah, myself included. The FDA told us that all 6 manufacturers of estrogen patches are continuing to work at full capacity and that only one progesterone manufacturer is experiencing delays. But I can tell you from personal experience, CVS, my pharmacy, has told me that both of my prescriptions are delayed with no estimated timeline for when they'll be back in stock. So I'm joined now by Dr. Rajita Patil. She's an OBGYN and the director of the UCLA Comprehensive Menopause Program. Thank you so much for joining us here this morning.
Thank you for having me.
So what's going on? Why are we seeing this?
Yeah, so I think it starts with the fact that we had this big health study that came out in 2002, the Women's Health Initiative, and it really kind of, the prescriptions really plummeted after that because of this fear. And so the suppliers really got used to a low level of needing to supply menopause hormone therapy. But I think in the last 3-4 years, we've seen a real rise, and part of that is because we have new data really giving us a little bit of assurance that if we start menopause hormone therapy earlier, it doesn't have the same risks. Secondly, we have lots of media coverage around this topic, and it's really raising public awareness, and people are talking about it. They're demanding this great care that they deserved, that they haven't received. Yeah. And then we have the FDA that removed this black box warning. So that was really the tip of the iceberg. We really saw this really huge demand for menopause hormone therapy, and the suppliers just have not been able to keep up.
So the FDA has not declared it a shortage, which seems very crazy to me because everybody I know who's on it is experiencing some sort of delay. Sometimes outright they have to miss their prescription and they go without. What would it do if the FDA declared a shortage? Would that help things?
Well, I think it would definitely boost the ability for these supply chains to really have an emphasis, a push towards addressing the problem. I, personally don't have a lot of experience, I should say, with something like this, but we don't see it that often where we have such a supply shortage. But I do think FDA, putting this on the list of drugs as being a shortage would really help.
And what about your patients? What are you telling them when they're, saying, I know I've switched 2 different pharmacies, but even that hasn't seemed to be successful. So what are you telling them? Because we talked about this, having an interruption in your care can really throw your body off, especially when you've been on the hormones for some time.
Yeah, it's really, it's really hard for patients because they feel like they have to go looking around for different pharmacies that are stocking this, and it can change from one day to the next. I would say that number one, be ahead of the game, and really kind of, when you have a month supply left or 2 months supply left, go ahead and start looking to make sure your pharmacy can give you the refill. You can definitely look at smaller pharmacies. They tend to have different abilities to get the patch, but also there's different options in regards to types of transdermal therapy. So we like transdermal hormone therapy because there's a little bit less risk of a blood clot.
Which is the patch that we're talking about.
Yes, the patch is one of those, and that's a very popular option because it's very easy to use. Most people I know is
what they use.
Yeah, but there's also a gel, there's a vaginal ring, there's a spray. These are all FDA-approved products, and so there are options to switch products. I know that it can be a little bit tricky sometimes when you switch between the different types, but these are all options.
And they're still as effective?
They are just as effective. There just might be a little, it's not an exact switch over in terms of the dosing, but most of the time they're pretty good.
Now, what about progesterone? If people have a shortage of that, is there an alternative besides the pill, which most women take?
Right. So we use the micronized progesterone, which is the bioidentical formulation of progesterone, which is easy to take. It also helps sometimes with sleep. There's patchy shortages on this as well. I don't think it's as big of a problem as the estrogen patch, but there are other formulations of the oral progesterone that we can use, and then there's also the levonorgestrel IUD or the Mirena or the Skyla, different formulations of progesterone containing IUDs, which can also be just as effective for protecting the uterine lining.
And before we go, because there are probably some women who are watching this who are either going to be there soon or are contemplating taking hormones. I know for me it has been life-changing. What do you say to someone who's like, I'm not feeling great, I'm having night sweats, I'm having brain fog, I'm having all these symptoms that come with, that change in our life. What do you say about what these hormones can do for women?
So we definitely know that hormone therapy really, really helps with menopause symptoms, especially hot flashes or night sweats, the same thing. So I would definitely not be living through those. I don't think anybody should be suffering with those symptoms. We do need to go see a educated clinician, whether that's a menopause doctor, your primary care doctor, an OBGYN, someone who can really listen to you and not dismiss this. And I also just want to put a plug in that there are non-hormonal options that work very, very well for especially hot flashes as well as night disturbances. So there's a lot of options out there.
Well, that's good. It's glad to hear that women have options, because for so long I think people felt stuck, like they didn't have anything. So thank you so much for coming on today, Dr. Rajita Patil. We appreciate it. And Jamie and Sheba, I'm going to send it back to you.